San Diego Connect.
You may not realize this, but as we get older, our chances of developing diabetes actually increase. Dr. Timothy Bailey is medical director of AMCR Research Institute in San Diego. That's a leader in diabetes breakthroughs. Why are seniors more likely to get diabetes, doctor?
Well, as we age, we are able to produce less insulin. So the insulin levels go down, but then the need for insulin can go up.
Especially if we're overweight, I would imagine.
Right, and sometimes seniors are less active.
Oh, okay.
So that sets you up for potentially developing diabetes as an older person.
Wow. Now, if someone watching is older, or perhaps there's a caregiver watching, or has a loved one who's older, what are the typical symptoms of advanced age diabetes that we should look for?
Well, the typical symptoms at any age are things like urinating a lot, urinating all night long.
Okay.
But there's some subtle symptoms, sometimes mental changes. Some people think it might be maybe you're losing your edge. Or even things like being irritable. So the symptoms can be kind of subtle.
That could sound like just plain old age.
So it's important to test.
Yes. And tell me, how do you test for this kind of thing in the research?
Well, you can go to all doctors understand that there's certain tests. You measure your glucose level, you measure something called a hemoglobin A1C. And the criteria are pretty clear that you can get caught relatively early and diagnosed.
And it's a good idea to get involved in a research project for many reasons.
Yes, because again, you get more attention,
and it doesn't cost anything if you're a research subject.
Yes.
Yeah. And why is it important for seniors who may be thinking, well, I'm already in my 60s or 70s or 80s, what do I care about getting diabetes treated?
Well, the most important thing is preventing the complications, because we all have heard about the terrible things that happen with diabetes, the amputations, going blind, kidney failure. But when you control it, the complication is nothing.
So controlled diabetes is fine?
You can prevent all of the complications of diabetes if you care for it.
Man, that is endorsement right there for getting it checked. Now listen, if you or a loved one think you may have late onset diabetes, simply call toll-free 877-567-2627, call during business hours. Or if it's easier, go online, myamcr.com.